Thank you very much, first of all, for this very kind invitation. I'm very honored to have this keynote lecture at the Indonesian Congress of Physical and Rehabilitation Medicine. I am Carlotte Kiekens. I am myself a physical and rehabilitation medicine physician. I am from Belgium. I worked there about 30 years at the University Hospitals of Leuven, but then I moved to Italy, and currently I'm working in Milano in the Multimedica group. But today I am talking to you as the co-director of Cochrane Rehabilitation, and I will try to explain to you who we are, what we do, and how we can be useful for you. Cochrane is all about evidence-based medicine. Just as a short reminder, you know that this is the explicit, conscientious, and judicious use of the current best evidence in making decisions about the care of individual patients and eventually populations. This is a definition that has been made some decades ago. When we go to clinical practice, we integrate this best available research evidence always together with our clinical expertise and also with the values of the patient. This is very important to keep in mind, but today we will focus on the first part of this triad. What about evidence and research? Well, the last decades and century, there has been an exponential growth in production of scientific papers, also in rehabilitation. And here you see the total number of papers published in PubMed, because there are also papers outside PubMed, on rehabilitation. And you see that there are some critical points where the growth was more pronounced, and that is, as you can see, so the first paper started after the First World War. Then we saw an increase after the Second World War, but then there was a very big increase in the last 40, 50 years. So we reached 1,000 a year in the 60s, then 10,000 a year in year 2000, doubled in 10 years, doubled again in less than 10 years, and last year there were over 50,000 papers per year. Obviously, it's impossible for whichever physician, clinician, or even researcher to read this all. That's why in the 90s, next year will be 30 years ago, Cochrane has been established. And Cochrane is a UK charity, but a worldwide organization that is gathering and summarizing, synthesizing the best evidence from research. And they do this by producing systematic reviews and meta-analysis, based mostly on randomized controlled trials, even though there are also now methods on other types of designs. As you know, systematic reviews and meta-analysis are at the top of our classical evidence pyramid. So Cochrane is the gold standard for production and synthesizing evidence. Within Cochrane, there are over 50 systematic review groups, even though I must say that Cochrane is now in a big change. I will mention a bit more about that later. And these are related to different health conditions for which groups are producing systematic reviews. That's in fact the core business of Cochrane. But then we also have the methods groups, working obviously on methodology for doing these reviews. There are the geographic centers, like for example Cochrane Indonesia, and then there are the fields. And fields are, the task of the fields is mostly knowledge translation for a specific health community other than a condition, like primary health care, child care, or child medicine, emergency medicine, first aid. And we created as a field in 2016 Cochrane Rehabilitation, because we know that rehabilitation covers a huge number of health conditions. And there were Cochrane reviews relevant for rehabilitation in over 20 review groups. So it's very difficult to find its way and to find all that evidence within Cochrane. That's why we created this bridge between, on the one hand, Cochrane and the groups, what is produced in Cochrane, and on the other hand, all the stakeholders, from clinicians to consumers to policymakers. And we work bi-directional. So we want to take out of Cochrane to practice the evidence, but also we want to work within Cochrane to work for for rehabilitation, and also working on the methodology, on reviews, and primary research on rehabilitation in order to improve it. We have a headquarters with director, co-director, coordinator, some people working for us within the headquarters that is based in Milan in Italy, but in fact we are also a worldwide network, and here you see the people who are a member of our advisory committee that are really supervising and doing most of the work, and as you can see they come from all over the world. The first 5 years of our work, these were the areas on which we worked. And these areas were in line with the Cochrane Knowledge Translation strategy. I will now briefly report on those. So the first area of work is the reviews. And within Cochrane Rehabilitation, one of our first tasks was to make the reviews more easily accessible to practitioners. So when you go to our website, which is rehabilitation.cochrane.org, and you click on the page Evidence, you will find all the reviews up to May 2021 that are relevant for rehabilitation. These have been tagged within the Cochrane library and put there, and you can access them in different ways. Also, I have to mention that 1 out of 11 Cochrane reviews were in fact on rehabilitation intervention, so 9%, which is really a huge number, more than we had expected. And here you see the evidence page, and you can select the full list or by subtopic. And by subtopic, you can, for example, click on health conditions, and then you can, for example, go on neurological or cardiac or musculoskeletal, but you can also search by professionals. So each professional can look which reviews are available in his domain of expertise. So you can go on professionals, click on physical rehabilitation, medicine, physician, and then you find the reviews relevant for your practice. The second area of work after the reviews is communication. As I said before, the fields are mainly working on knowledge translation, knowledge dissemination, so communication is crucial. And we have different means for that. First of all, we have our website, as I mentioned before, where you can find a lot of information on our activities. We have a monthly newsletter. So if you go on the home page and you click here on monthly newsletter, you will receive it every month. And in the newsletter, we have a summary of the different activities, of published papers by Cochrane Rehab, on blog shots, will I explain immediately, on congresses where we will be present, or other useful information regarding evidence in rehabilitation. Then we have information dissemination through all the possible social media, from Facebook, Twitter, Instagram, LinkedIn, YouTube, according to your preference. And you can see that we have quite some followers, and they are still growing. One of the activities within communication, as I said, is the production of blog shots. What is a blog shot? Well, a blog shot is, in fact, as you can see here, one slide in which we summarize the results of a Cochrane review. So we screen all the reviews that are published, and we decide in a group of 4 people, is this relevant for our audience, yes or no? If yes, we synthesize the results, the adverse effects, and the number of patients and studies that were in that review, and we spread this blog shot. This slide is then in our newsletter, and we spread it through social media. The original version is always in English, but then we are also working with a translation team and with different translators around the world. For example, Dutch, French, Italian, Spanish, Croatian, Hungarian, and then we spread them also in these languages in the appropriate community. We don't do Indonesian yet, but this is something we could, for example, start doing in the framework of our collaboration. Third working area is publication, and here we publish mainly Cochrane corners. A Cochrane corner is again like the blog shot, but a bit longer. It's a short paper of 1-2 pages, summarizing again a Cochrane review, followed by a comment from a rehabilitation perspective. So at the end, we usually have a chapter of what is now the implication of this evidence for your practice. And we are working with about 14 or 15 international rehabilitation journals, and each journal has 1, 2, 3 corners per year on a Cochrane review relevant within the field of their audience. Next working area is methodology, which is a very important one. And here we really work in the other direction of the bridge, working from the field of rehabilitation towards Cochrane on improving and strengthening methodology for research in rehabilitation. As you know, research in rehabilitation is very complex because we have very different types of patients, usually a lot of comorbidities, heterogeneous groups of patients, and also complex interventions, multidimensional, multi-professional. It's not like, for example, arterial hypertension, where you have one medication versus a placebo, which is very clear-cut. No, here we have a lot of interfering factors, the therapist, the type of therapy. You often cannot blind, neither therapist, neither patient. So it's not so easy to do good quality RCTs within rehabilitation. And here we are working on, I will give some examples later when I discuss our projects, on improving this methodology, because if you have higher quality primary research and papers, you will have also better outcome of the systematic reviews, because now it's still very often that we have not enough evidence or low quality evidence to make sound synthesis of evidence on a specific topic. Cochrane Rehabilitation has a lot of partnerships. We have different types of partnerships with bigger world organizations, professional and scientific organizations. We have some financing partnerships, also with institutions, with research institutions, with journals, and then with national societies, of which we were very happy to sign one with your organization in Lisbon during ISPRM. In December, we had our 5th anniversary, for which we had some webinars and we reflected in some workshops on the activities done up until now, but mostly also how to go further the next 5 years. We also revised our vision, mission, and our goals, and again to align with the strategy for change that is going on within Cochrane. The 3 main goals of Cochrane remain to produce evidence, but also the other goals are important: advocating for evidence, and then in the end to inform health and care decisions. Our vision is a world where all clinical decisions in rehabilitation are based on the best available evidence that is easily accessible and understood by all rehabilitation stakeholders. That's where we want to arrive in the end. For this, we want to improve production, synthesis, dissemination, but also, and this is a bit newer, implementation and impact of rehabilitation evidence at all levels, individual, organizational, but also at health policy level, with a global view beyond all types of rehab professions, culture, language, and also the economic resources. So these new items in the mission will reflect also in our goals. These goals, we already had them before, being a network that we already are, so we worked quite well on this. We do already a lot of knowledge translation activities, but now we want to work more also on implementing evidence-based clinical practice through education and training to stakeholders, and increase knowledge and skills for producing and synthesizing evidence. We will continue to work on methodology. And what is also new in the goals is develop strategies focusing on the specific priorities and needs, and also their barriers in low and middle income countries, and also on how to impact more health policy. We also want to work on give guidance on how to work in emergencies from the lessons learned from the pandemic. I will now present you some of our special projects that have been going on within the framework of methodology. The first one is an e-book where you find again all summaries of the different Cochrane reviews that were tagged relevant for rehabilitation, with summaries for different audiences. This was achieved in collaboration with the different European PRM bodies and has been launched in Lisbon. The second project is what we call the B for Rehab, Best Evidence for Rehab, in the framework of Rehabilitation 2030, which is a project by the WHO to upscale and strengthen rehabilitation worldwide. Therefore, they are making a package of interventions for rehabilitation, and Cochrane Rehabilitation collaborated with the WHO in providing, in extracting interventions from, on the one hand, clinical guidelines, and on the other hand, Cochrane systematic reviews. Here you see the 6 phases of the project, and Cochrane Rehab mainly worked in the second phase where we identified all these interventions. And you see here also the 20 health conditions for which a package will be made. And we hope, or the WHO is planning to launch this package in early 2023. This will be a very important document with which you can lobby at health ministries to say, well, this is really the minimum standard that should be provided for patients with these health conditions. So here you see one example of a paper we made doing an overview of these systematic reviews from which we extracted interventions for spinal cord injury. We did this also in using an evidence map. For more details, I refer to the paper. Then we have 2 projects to improve, on the one hand, the research as such, but mostly also the reporting of research and RCTs in rehabilitation. Some years ago, we did a study published in the Journal of Clinical Epidemiology on the replicability of studies. So when you read a paper, it's very important that you understand well what has been done, and also to be able, if there is evidence on an intervention, to replicate or to do it in your own clinical practice, or to replicate it to do further research, to confirm, for example. And we saw that very often a lot of essential information is lacking. Therefore, we are developing a checklist of which we had different Delphi rounds and consensus meetings. And we have now version 5, where we describe 14 adjunctive items specific for rehabilitation as a sort of add-on to the CONSORT guideline for RCTs. Here you see these 14 items. This work will be finished in the next months and then also published. And some preparatory work has already been published before. Doing this, we made another extension called Guide Rehab, where we describe with guidelines how to describe interventions, rehabilitation interventions, but also how to describe the comparison, so 2 elements of the PICO in the material and method study section, but not only for RCTs, but for any type of design of rehabilitation studies. So the description of the intervention, of the comparison, but also of the common background treatment, because it's very different if a patient does nothing next to the intervention or the comparison, or if, for example, he's doing half an hour of a intervention, but then with 3 hours of background other rehabilitation treatment or co-interventions. And here you see the 23 items that should be described in detail in order to have these informations. We worked a lot on COVID-19. We started in March 2020 as Italy was hit very early and very hard by the COVID pandemic. It was a new health condition. There was no evidence, so there were different ways of producing and collecting evidence. And one of them is that we did an interactive map where we continuously collected and searched all the new papers on COVID-19 and rehabilitation. That first were obviously case reports and epidemiological studies, and now there are also some RCTs and other types of studies. And these are continuously updated on our website. And we also produce since the start a rapid living systematic review. So rapid because it goes faster with a slightly light version of the methodology, and living because it is continuously updated with new evidence that is published. At the start, we published every month a review, then every 2 months, then a couple of times per year, and now we will do the next one next year. But the map and the tables with all the contents continue to be updated on our website on the COVID page. Here you see one, the last update as published in the European Journal of PRM. Here you see the map, and according to the size of the circle, there are the number of studies, and if you click on the circle, you have an overview of the different papers that has been published. And according to the color, you see the level of evidence or the type of study. We also provided information to the WHO on making 16 new recommendations for rehabilitation of adults with post-COVID-19 condition that has recently been launched in September, and you can find this clinical management of COVID-19 document on the website of the WHO. Lastly, I want to briefly introduce you to the rehabilitation definition for research purposes project. While doing a lot of our activities, for example, the tagging, we realized that in order to decide whether a systematic review was or not related or relevant for rehabilitation, we didn't have clear criteria. There are a lot of definitions on rehabilitation, but there was not one that could help us in there. So that's why we decided on doing this project to make a definition that is usable for research purposes. It was a long process with a first version after a methods meeting in February 2020, and then a lot of online consensus meetings and surveys. And we recently, a couple of months ago, published our first version. Here you see the reference of the paper. Here you see what the definition became. It's quite large, but it's also because it has to be very precise. So rehabilitation is, we followed for this definition on the one hand the PICO and on the other hand the ICF reference. So we decided together with a large group of all professions and all regions from the world that rehabilitation is a multimodal, person-centered, collaborative process, including interventions targeting the person's capacity by structures, functions, activities, participation, and or contextual factors related to performance. The goal is optimizing functioning, and we deal with persons with health conditions experiencing or likely to experience disability or persons with disability. All these different elements have been thought about and discussed largely, and you find all that information in the paper and its supplements. So I really encourage you to have a look at this paper. We recently also published an evidence editorial, as we call it, where we comment on 3 very important documents that were published the last months. One from the Global Commission on Evidence, an initiative of Covident. One from Cochrane. Cochrane convenes, preparing for and responding to global health emergencies. And the third one, which was actually the first one, the EVIPNet call for action from the WHO. And all this information were in fact conclusions and lessons learned from the importance and the need of evidence during the pandemic. And we reflected on these documents from a rehabilitation point of view. And I think if you read this, you will also understand the importance of evidence within rehabilitation. So I gave you a lot of information in a very short time. I even probably went a little bit over time, for which I apologize. If you have any questions, please reach out to us. You can find all our details on the website. I invite you to follow us on our socials and to subscribe to the newsletter. Terima kasih. Thank you very much for your attention. And again, thank you for the invitation.